Some patients are reluctant to come to hospital when they have chest pain. The reason is usually because they are unaware as to what may happen to them, what tests will be done to them. So, to clarify a few doubts, let's talk about the certain investigations or tests that will be done when you come to the hospital with chest pain. When you come with chest pain for the first time, main issue is whether this chest pain is because of a heart attack or not. So we normally do tests in a step-by-step manner, starting from the simplest investigation going on to more complex ones. The simplest of them all is the ECG, the electrocardiogram. By doing this simple ECG test, we can get a good idea whether your chest pain is due to a heart attack or not, and we can also see your heart's rhythm and heart rate and lots of other information. Apart from that, we also do blood tests. In particular, a blood test called troponin, which is increased or elevated when somebody has a heart attack. After doing the blood test, we do another investigation called a 2D echocardiogram. This echocardiogram test is a very important investigation in assessing someone's chest pain. An echocardiogram is done to assess the function of the heart. Let's show you how this echocardiogram test is done. We use this echocardiogram machine. We use some gel, keep it on the patient, and we put the probe and have a look at how the heart is functioning. The echocardiogram is a very simple investigation. Takes about 5 to maximum 10 minutes to perform, and it's pain-free. By doing the echocardiogram, we get a lot of information about the heart's function and also the function of the heart's valves and many other data as well. In somebody who comes with chest pain, this is a very important investigation, especially if we are suspecting that they may be having a heart attack, especially to have a look at the function of the heart. We can have an idea whether there has been any heart muscle damage or not. This exercise ECG test is done while walking or running on the treadmill, and we assess the changes on the ECG during this exercise. By seeing certain changes, we can assess whether you have any narrowings of the heart's blood supply, in which case we need to do further investigations for assessment. From these 3 very simple investigations, we can get a very good idea whether your chest pain is due to a heart attack or not, and we can forward you to the correct and appropriate treatment options as well. Apart from these very simple investigations, there is also the more complex investigations where we suspect that if you may have a block or narrowing of the heart blood vessels, especially a coronary angiogram, and sometimes we do CT angiograms, etc. All these tests we do in a stepwise manner in assessing someone's chest pain, and it is done in an appropriate manner as well according to the need of the patient.